Hello, I'm Mark Rickenbach. I'm one of the visiting professors at Winchester University and a general practitioner. And I want to talk to you briefly about using duration to guide you on how you handle a condition, a medical health condition in general practice. And this may be of interest for you as a patient, but primarily we're aiming at doctors and how they handle consultations. So the duration of symptoms will determine what you should do next. So, and it's a really important thing to think about because it makes the consultation much quicker if you consider it early on. So if somebody comes to you with symptoms and you can ask fairly early on how long have they been going on for, and this will alter your management. So for example, and people do come to me with symptoms that have been there for an hour, which are minor. And the important thing is it depends on what type of symptoms as well, of course. If it's chest pain, you need to work on it immediately. But if we're thinking of relatively chronic symptoms that are not going to cause an immediate problem, then if it's just gone on for a day, you're just going to watch and wait. If it's gone on for 2 years, you're going to look into it, but there's not the urgency to address it immediately. But if it's gone on for, say, 6-8 weeks, then it's getting into the realm of duration of symptoms that could be serious, and it's hard to tease it out, and that's the group that you're going to have to focus on. Now of course it depends a lot on the symptoms, as I've already mentioned, and often when a person comes into the room you can gauge how unwell they are just by the way they're walking, the way they look, and quite early on in the consultation you can find out what category this sits in, whether it's really serious or something that you can watch and wait. So I've talked about chest pain, coughing up blood, pain in the calves. They're things that you have to work on immediately, whatever. But more chronic symptoms like an ache here or mild irritation there, it depends on the duration as to what you're going to do. And the other thing it depends on is the course of the symptoms. Now if those symptoms have been getting better, then you're going to sit and wait for them to resolve. If those symptoms have been coming and going, then you may continue to observe. If you're getting worse and worse, then clearly that puts the pressure on to address it there and then. Bearing in mind that the majority of symptoms will clear on their own if they're not of severe nature. So when a person comes to see you, think about assessing the symptoms and signs, but also ask early on about the duration of the symptoms, and then consider the course that it's taking, getting better, worse, or fluctuating. And these things will make a big difference to the way you handle a consultation and how quickly you can move forward and make a plan shared with that individual patient. If you want more information, go to www.docrick.co.uk. Hope that was of interest. Thank you.